All right, you made it. It's December 8th. The annual enrollment period is officially over. It's time to do a few things to make sure that your life is easier, your client's life is easier, starting for January 1st. Because the first part is done. Hopefully, you did it correctly. Hopefully, you got everything submitted correctly. Hopefully, everything got processed correctly. So, number one thing you want to do, you want to do 5 things right now. You want to execute with your clients right now, whether you help them do a new plan or not. I would do this with all of your clients, your whole book of business, the entirety of all the people in your family, however you want to word that. You got to go through them all, and you're going to do a few things. Number one, application verification and error sweep. So you want to go through. Our objective is to prevent client compliance issues, reduce carrier pending status, and lock in clean business. So confirm all signatures, dates, plan selections match. Okay. Make sure that the application showing pending in the system is, in fact, the application you intended to submit. Make sure that the correct plan has been selected and or processed. Make sure that the name is spelled correctly. Make sure if it's applicable, the doctor is on there correct. Okay, we're looking for contact info being correct, email info, phone information, PCP, Medicaid status, effective dates, election period. We want to verify all of those things and make sure that, in essence, the way you do that is go in and see is the application process. Because if it's pending, then it probably had something wrong with it. If it's pending or future active or pending future active, each carrier kind of words that differently. But if it's showing active for January 1st, then you know the application was correct. It's been processed. Okay? So we want to reconfirm all that. I would also screenshot. Okay, it's always good to put it in the CRM. You guys can get in the habit of downloading stuff and just putting it in the CRM as you come across it. It saves you from having big blocks of time having to go back through with inefficiency. You don't want to have an assembly line of piles of stuff to do. You want to have an assembly line a system and process that finishes the system and process front to back so you don't have a bunch of unfinished business. Okay. Number 2. Carrier confirmation and status tracking. So again, we're looking for every app showing approved, future active, so whatever the acronym is. We're going to log into the carrier portal. We're going to tag it. We're going to tag it with, is it received? Is it in process? Is it pending additional info? Is it approved? We're going to tag it with whatever the current status is. And again, I would use 2026 app status approved, 2026 app status pending, 2026 app status need additional info. Whatever those different ones are in each of the systems that you're going to be accessing for Humana, Anthem, Aetna, Devoted, United Healthcare, et cetera. Okay, you're going to go in and you're going to tag accordingly. Make sure you're tagging what plan they enrolled into for this year, so you have the current information tagged properly for that. Okay, if pended, figure out what's going on. Send off a service request, send off an email, follow up, make phone calls, whatever you have to do with agent support. And then again, make sure you're updating your notes. Double check to make sure you have your notes from your appointment in there dialed in. Do you have all the proper notes in there, documentation? Do you have your scope? Do you have the call recordings? Is everything dialed in and organized? And can you one by one check them off? And okay, once you've done this, put 2026 January audit complete and make that tag for that and go through and get your whole book of business tagged as audited and verify that they're active. Number 3, and while you're in there verifying where it's applicable, double check to make sure the primary care doctor is aligned. Make sure that you've sent them the estimate and the summary of benefits, the estimate for their RX costs. So you've put their RX cost into Sunfire or Medicare.gov, hopefully 2 layers of it. What I would do is I would go directly to the carrier site if you have any questions or concerns about the validity or accuracy. But otherwise, I would make sure you at least send a PDF of the annual summary for what the estimates for their medication costs are, how much to expect and when as far as their copays are concerned to get their medication. Surprises are not enjoyed by any clients, okay? We want to reinforce the trust. So the next step after we verify the info, after we tag all the info, after we process all the data, after we put together our welcome kit. All right, y'all, so let's talk about what in the heck is in the welcome kit. Number 1, get yourself a hot pink or other bright colored, oversized envelope. It doesn't cost you really any more or less to have color. It costs maybe a little bit more, but it's so worth it on the impact because they won't miss it. We also put a fish sticker on the envelope. Okay, fish sticker on the envelope. Hot pink is our choice, and there's a couple reasons why. Number two, make sure you have the summary of benefits book for whatever company or plan that you're doing. And what we like to do is have business card stickers that we put on to the front of the kit. That way, if they have questions, they have our information really quick, easy, simple. We also have a 3-pack of business cards, normal business cards, okay? We also have a magnetic version of the business card, okay? And then we have a magnet, calendar magnet, also with our contact information on the bottom, okay? And then we have a thank you, welcome to the family card. So all these things go in along with a handwritten letter. You're going to put them all together. You're going to put them in the envelope. Bada boom, bada bing. You got yourself one amazing welcome kit ready to be delivered to their house through the postal mail, or you can hand deliver it. All right, last step, and then you can focus on growth again. Again, this is the first phase of retention for all these new applications and or clients you're trying to retain who stayed on their plan. Okay, so the next step is to document everything in your CRM. Make sure you have everything tagged properly. Send them confirmations in a text, an email, and if you like, a voicemail drop to the client to let them know your application has been processed. Let them know if their ID card is available for download. Download that, attach it to the email, text it to them. Go all the way, one step above. 1% better is all you need to dominate your competition and create a top 1% organization. What you want to be known for is top 1% retention, top 1% in growth, top 1% in referrals, and all these things come from being dialed in on the front side of your process. How is your client welcomed or re-welcomed into your family, into your book of business, into your client base? What does the onboarding process look like? How do you make them feel in that process? Are you asking them about their family, their friends, their dog, their cat, their neighbor, whatever is important to them that you learned about during the fact-finding process, right? We did all that for a reason. We're saving it for now so we can really hammer home and dial in this relationship. We want a lifelong relationship. We want fanatics that can't help but tell their family, friends, neighbors, etc. about you. We want them to tell them about you. So get this last step done, and then you can focus on rest, relaxation, the holidays, and most importantly, how are you going to take advantage of the open enrollment period, a time where you can help people but can't necessarily advertise it as such. It's more of an educational campaign, and we'll have some videos to help you with that as well. Thank you for tuning in. We will see you on the next Momentum. It was way longer than a minute, but we needed to do it.